Health experts say cases of multiple sclerosis in Australia are rising at a dramatic rate. The illness affects many more women than men, and it often affects people in their 30s. Medical reporter Sophie Scott has more.
So the jump's about 30% in 4 years, Roz, which is quite a substantial increase. They think there's a number of reasons why. One reason could be an increase in obesity, particularly in teenagers, and they know that if you have a diet in ultra-processed foods when you're a teenager, that can increase your risk of MS. A second reason can be the fact that women aren't having babies as often, or they're delaying having children. We know that there's a direct link between having kids. The more kids you have, the more protective a risk factor it is against getting MS, which is really interesting. I did a really interesting story a few years ago about a woman with MS, and what they've found is when you get pregnant, even if you've got the condition, your symptoms all completely disappear. So it's a fascinating link between pregnancy and MS. And the third reason that they are thinking that this jump might have happened is the lack of sunlight. We know that there's again a direct link between the amount of sunlight that you have and your risk of MS. So the further away you are from the equator, the higher your risk of MS. So, for example, in Australia, we see the highest rates of MS in places like Tasmania, where there's colder climates. And so they think that of those three factors, there's probably a combination of those three that have led to this increased rise in cases.
So just remind us what MS is.
So MS it's an inflammatory and a degenerative condition where the nerves in your brain and body become damaged. The protective sheath around those nerves becomes damaged, and that means that the brain and the body can't talk to each other as effectively. And it leads to things like vision loss, loss of coordination, pain and fatigue. And it can be very debilitating. Symptoms can come and go, but they can also get worse as people get older.
And it's a costly disease, isn't it?
It really is, because, as you said in the intro, it strikes people in their 30s. Often, if you're thinking about, that's when people are at the, just starting their careers and then thinking about having children. So it's costly, not only on a personal level, but on a loss of income level as well, and a loss of income for society. And that's why it really is quite a significant burden for our society in Australia.
So is MS preventable then, Sophie, if people take certain precautions?
Yes, look, it's not totally preventable, but there are things that you can do to reduce your risk. So not smoking is one thing. Things like making sure you get adequate sunlight, maintain a healthy diet and a healthy weight, and having children, if that's on your agenda, that will help. The other interesting thing is the Epstein-Barr virus is implicated in MS. So people who have MS have generally had the Epstein-Barr, the glandular fever virus, in the past. So making sure you don't get that is another way of preventing getting MS as well.
Thanks, Sophie.